Can
I
anyone
can.
hear me? Can anyone hear me? Am I good? Am I on? Hello? Okay.
I can hear you, Doc,
All right. Well, then I'm going to
but
just
I
start
don't.
talking. Let's go right to the data. And if this is wrong, then we're going to have to do something else. Let's get to the data. Okay. So basically, the long and short is our numbers are starting to rise slowly. We're at a 5.5% positivity rate, which is increasing slightly every day. Next slide. And we have the beginnings of another upward slope. Next slide. This is our vaccination rate, which is stagnant and stable. Next slide. And this shows the communities in pink that still remain more under vaccinated than others. The greens are generally in better shape. Greens are at least 50% or higher, where the pinks are generally under 40%. So you can see our rural areas and some of our downriver areas remain under vaccinated. Next slide. And our dashboard as we continue to count and count and count. Can you hear me?
I
Are
can
they able
now.
to hear me? Okay, so let's get to the questions.
Okay. Do you want first, Doc? Let's talk on your talking points about the behavioral risk factor survey.
Okay.
And the difference
So
between the
you
grouping
may
and
have
such.
heard us in the past doing our community health needs assessment. It is time for us to do this again. And the first step is for us to collect what we call primary data. We do that by hiring a survey company that calls roughly 1,000 to 1,200 households and asks them a series of questions about their health status. It's called the Behavioral Risk Factor Survey, or BRFS, and it has begun in the field. So you may get a call, and your caller ID, the third-party call center is called Wilkins Research. Your caller ID may show a 423 area code, as this research company is calling out of Tennessee. The survey does take 10 to 20 minutes, and of note, they should not and will not be asking, if it's our survey company, will not be asking you personal questions such as Medicare or Medicaid numbers, account details, social security numbers, passwords, etc. They will be just asking you questions about your state of health, whether or not you visited a doctor in the past year, things of that nature. And I'll just remind you that the survey information is confidential and will be reported in anonymous aggregate fashion. So if you are unsure about the call you're receiving, hang up and call us at 810-987-5300, and we will make sure that we're on the right page with you. Okay? Yay, thanks, Mike. They can hear me now. Oh,
Yes.
I'm
All
sorry
right.
about that. All right, so
We
let's go
appreciate
ahead and
everybody's patience.
get to this question. Note to
Okay.
self, always have IT here in the building when we do these things. So the first question is there any more of the Delta variant in St. Clair County? And the answer, of course, is yes. We received notification of our first Delta variant several weeks ago. That individual case had many exposures. We assume that there is much Delta here, if not most Delta here. And if it's not here as a majority of transmission, it will be soon. So just assume that we're going to be seeing this next wave in with primarily the Delta variant being the driver of that.
Hey, Doc.
Hmm?
Doc, you do want to mention that we had been moving to a monthly show, but now we're going to go back weekly for the time being, like we said we were going to do?
What Jen just said, we're going to go back to weekly because of all this, right? So we'll be here every Thursday, hopefully on time at 3:30 to answer your questions every week on Thursdays at 3:30.
Okay, I'll do your next question.
All right.
These questions that we're reading off came through last night and earlier today, and then we'll get to the live feed. When officials say the statement review of records, what exactly does that mean, and how did they obtain that information?
Review of records.
Not sure what they meant by that.
I'm not sure what they mean by that. So as you know, there is a Office of Vital Statistics at the state as well as the national level where data is collected. I would imagine maybe I don't know what people mean by that.
How about this? How about if this person is watching today?
Yeah, you
If
could
they could
maybe explain that a little bit better.
yeah, be more specific, or you can send us an email at covid19@stclaircounty.org if you're not listening this very moment.
Mhm.
Okay, next question. How will schools be affected this fall? Will masks be required or will it be a district choice?
Oh, that's a really common question, and the answer is there is no statewide mask mandate at this point for schools or for the general public, period. Nor will there likely be any. So therefore, masking will be a recommendation that comes from us as a public health entity, or perhaps from your employer, or perhaps from whatever entity you're working at. Employers and individual businesses can require masks as a component of their employment. In schools, that will be up to the school districts to decide if they will require it. Masks, however, will be recommended as per the CDC, MDHHS, and now many of the official national pediatric associations as well. So we all know that masks protect us and protect others, so that reality has not gone away. What's gone away is the requirement for it based on the state epidemic orders.
So, Jack, do you want to talk about in your notes there what the health department will be doing as far as we will make recommendations, but we will also be requiring certain things?
Oh, I didn't know you wanted me to talk about that. Well, there are requirements that are just part of public health law. So it will be a requirement, for instance, actually to report suspect or confirmed COVID cases to the health department. It will be required by law for COVID case counts to be on the school website. So they'll still be required to report how many cases are occurring in their school district. Masking is required on school buses and public transportation. That is a CDC order that is still in effect. So public transportation, if you travel on a plane, you already know this, but buses, all those things, you need a mask. You are required to keep employees sick or exposed at home. So isolation and quarantine requirements are still valid. So we still require an individual with COVID to remain out of work or out of school for the 10 days of isolation as determined by our contact tracing. And then if you have exposures, we still will require quarantine based on the circumstances. So that is really everything, isn't it? I believe
Okay.
that's everything.
Yep. Okay. The next question then, this person would like to know the numbers on people who get COVID while being vaccinated versus the people who aren't.
You know, that's still, I think, really a little too soon to be able to say for sure. We do know that people are getting COVID after vaccination. The last, my picture is really fuzzy here, by the way. I don't know if that's the way it's supposed
Yeah.
to be, but the last study I saw for a large cohort suggested 1% of the population was getting infected after COVID vaccine. However, that was pre-Delta. Okay. Delta has changed things, and I haven't seen any numbers. But we do know this. We do know, I think I just saw a study that came out yesterday that if you're vaccinated, you're 3 times more likely to get infected if you are unvaccinated. So the vaccine still has a strong protective mechanism. We do know, unfortunately, that you can still get infected and spread COVID after vaccination, particularly with this Delta, which is why a lot of these recommendations have changed in the past couple of weeks. We also know that the vaccines, all of them, are very effective still in keeping people out of the hospital and from dying. 99%, almost 99% plus of everyone in the hospital right now from COVID is unvaccinated. So those are some statistics I think that are worth remembering. The actual details of how protective, what we call vaccine effectiveness of this vaccine against, or these vaccines against the current variants. It's going to be a real changing picture. It's going to be hard to catch up with that, I think, for a while, but we'll report it as soon as we get some valid studies in our labs.
Okay. Somebody replied back about that review records, Doc. So
oh yeah, okay.
Karen says, review of records, when they give a count of cases, they always say a certain count from a review of records.
Talk about cases. So yeah, so I mean, data collection is complex, if we're talking about case counts of COVID, then those cases are collected through a variety of systems, labs, hospitals, and local health departments, who all then funnel the system into what we call an MDS system, the Michigan Disease Surveillance System. And once they get logged into there, you can pull epidemiological data from that. So I would assume, now, each time some data comes into, for instance, our possession from a hospital, from an individual report, business report, etc., we investigate that report first before we put it into the system. So we review the records to make sure it's a valid case before it goes into the system. And it goes into the system as confirmed, probable, or suspect. It's kind of complicated, which is why when we argue about numbers and cases, it's a little hard for us to explain why numbers vary a little bit from place to place. So review of records, I would assume, means that they're looking at either the MDSS system or vital statistics records, which are usually a couple years behind. So that wouldn't be where we get real time data. It would probably be from the MDSS system.
Okay. The next question that came in, have there been an increase in vaccines given since the onset of Delta?
Yeah, Brandon just texted me today about that. I guess there has been a little. I mean, it's still pretty stagnant, but I think there has been a little bit more interest. Thank God, I can say, as I was kind of hoping that would make people kind of think about this a little bit more. But yeah, I think there's been a little, not a dramatic increase though, I don't think.
Okay. The next question, is a third Moderna shot available? Are boosters recommended? This is a common question.
Boosters are the common question. So lots in the news about boosters. Do we need it? Should we get it? Blah, blah. They're still studying this, okay? It's a complex science. We don't even know how, we just talked about vaccine efficacy with our current status. So there's a lot of discussion at the ICI, at the level where we have these large think tanks reviewing all the different data, both published and unpublished. And it didn't help that the manufacturer came out and said, oh yeah, you should do this booster. But we're not there yet, people. And there are no boosters that are currently being recommended in the United States, period. There are no boosters being recommended currently in the United States. And if that changes, we'll be the first to tell you about it and why and regarding what. But right now, it doesn't matter which vaccine you received or how long ago you received it. You shouldn't be seeking a booster. It will be outside of the EAU guidelines, recommendations, and we don't want to be doing that. So don't be begging your doctor or your pharmacy to give you a booster either, because quite honestly, they shouldn't be doing it. It's not cool to do things outside of those recommendations.
All right, the next question is several questions about Delta variant. Mm-hmm. So this person asked, if one was already naturally infected with COVID, can they be reinfected with the Delta strain?
Yes.
Okay. Does the Moderna vaccine protect against the variant?
Yes.
What are the symptoms of the Delta variant for those vaccinated and not vaccinated?
I don't think there's any significant difference that I have seen so far. There's anecdotal reports of the Delta causing somewhat different, but when you actually look at what they've collected, the symptoms of COVID are already pretty vague and diffuse, right? Everything from body aches to headaches to fever. So it's not like there's a lot of variation there, there's already a lot of variation there to begin with. So I think it's going to be like looking for a needle in a haystack, trying to find subtle differences in symptomatology based on these variants. I wouldn't worry about that. I just go get a test if you think you're sick. Go get a COVID test. The tests are still very accurate and valid, by the way.
All right, this also, next is a two-part question. This person said, comparing vaccination rates between Florida, 49.2, fully vaccinated, and Michigan, 49% fully vaccinated, our vaccinated rates are basically the same. It appears our current numbers are approximately 6 weeks behind Florida. Can we expect to see a similar increase mid-September once everyone moves back inside and school resumes?
So our caller, our person there is trying to do something that the whole world is trying to do, which is called modeling. There's a lot of very complex modeling going on out there, and I can tell you so far they're not really hitting the mark. They're not doing a super good job. I don't know. I would suspect that what's happening in Florida is they're all going inside because it's summer, and summer in Florida is horrible. You go inside, unlike what we do. I would think this has a lot more to do with exposure and individuals being close together. If that's the case, we could expect to see more cases when we go inside or when we start gathering on indoor locations.
Okay. This is the second part of their two-part question. Previous COVID strains has a relatively small effect on children. With the Delta variant, this does not appear to be the case looking at India and Indonesia, and closer to home in Florida, pediatric cases are up 87% from last accounting. With that being said, is masking and social distancing going to be advised again for the upcoming school year, particularly the daycare and elementary age groups?
First of all, let me be very clear that I don't think the data is very clear at all that the virus is more impactful for young people or that they're more at risk of getting serious illness. What we do know is that the age of hospitalized individuals is going down. The younger individuals, but that's because most of our elderly people are vaccinated, and I just said that vaccine does seem to have a strong protective effect against hospitalizations. And the vast majority of people who are unvaccinated are younger people. So that could be really what's driving this difference in ages as we talk about hospitalizations. So going back to, does our concern about young people, though, in general, drive the idea of more mitigation strategies in school? And the answer is yes, of course. Whether or not the infection is more severe in young people or not, we already know that young people can get the infection. Although serious infection is rare, it does happen, and we do know that they can spread the infection just as easily as anyone else. So we do want schools to pay particular attention to what we're calling layered mitigation. It's not just masking, it's cohorting, keeping people in smaller groups so that one case does not expose an entire building, making sure that they try and stay that 6 feet apart. We've compromised with 3 feet because of some limited data that's come out. We might go with 3 feet just because reality, our schools aren't big enough to do 6 feet distance. We definitely want to be aggressive with isolation and quarantine. And I'll just throw it out there, as much as everyone hated it, targeted testing can be a very effective tool. It allows us to identify early symptomatic and asymptomatic individuals early on in their course of infection before they walk around and infect people for days and days and days. So we are just now having those conversations with our schools. They're engaged. They're struggling to try and find that compromise, and we're just going to do the best we can as we move along, and probably follow the data and follow the caseloads and really just kind of gear up as the situation changes.
Okay, the next question is, can you please talk about the future risk of birth defects and the studies that have been done on all of this for all the vaccines? My younger daughter wants to have children someday and is willing to wait until there's some data and history for young women who have received the vaccines and are having children.
Right.
Is there a
There,
public
there
health
is no, there is
organization?
no data to be showing any concern about birth defects, miscarriages, terminations, etc. That data has been looked at, continues to be looked at, and there are no red flags. Nor is there any biologically plausible situations where vaccines cause birth defects. Just our immune system doesn't do that to our unborn babies. So there's and there is no reproducible effects on the unborn babies with the millions and millions of women who've had COVID, which, by the way, produces a very, very robust immune response. So if an immune response from a vaccine, you're saying could be a concern, certainly immune response from a natural infection would cause the same, if not greater, concern with a fetus, and it does not. We are not seeing any impacts on fetuses or babies from COVID. What we do know that is pregnant women seem more susceptible to severe infections from COVID. We do know that, along with other risk conditions. And the OBGYN Society of the United States, ACOG, I believe they call it, has now officially recommended the vaccine to pregnant women because they are more susceptible to severe infections. So we're very confident that these vaccines are not causing future fertility, bad baby stuff. It's just not there. And I would just say that our surveillance system for vaccines is very sensitive and able to pick, it's robust enough to pick that up. Remember that our surveillance system was able to pick up very small increases in myocarditis, the thrombosis associated with J&J, and the Guillain-Barré, which is tiny increases in rates with the vaccine versus through the natural occurrence of this. So our systems are able to pick this up, and we have not seen it. It has not been seen in clinical trials. It has not been seen in natural infection. It is not historically a concern with vaccines. I would not be concerned about getting a vaccine as a woman of childbearing age if you were wanting to have children in even the near future. It would not concern me to get any of these vaccines.
Okay.
For that reason.
This person also asks, are they going to start mandatory vaccination policies for young people to fully participate on school campuses?
That would be up to the different schools. As you have heard, I'm sure different businesses and agencies are making, in schools, I think some colleges have made these decisions. I guess it would depend on the school you're referring to.
Okay. This person wants to know, what's the recommendation for indoor dining for two people who are fully vaccinated to go out with two who are not, but are months past severe COVID positive recovery? Go, don't go, mask up.
Oh, that's so hard. So yeah, I'm still going to restaurants. If it's a tightly packed restaurant, I try and wear my mask until I'm sitting down eating. I certainly feel a lot more comfortable if the waiter and waitresses are wearing masks because they're going from, place to place. I'm more comfortable in an outdoor dining situation than an indoor dining situation. So I think you really just have to call that. We do still assume that there's good natural immunity from a previous infection, but we don't know, again, how long that lasts. So we're still officially giving that 90-day recommendation. If you've had an infection within the last 90 days, you can safely assume that you're probably not going to get reinfected. But that was data from pre-Delta, and the caveat here is this is a emerging pandemic. And if you're frustrated about how things change every couple of weeks, every month or so, everybody is, but that's the nature of this virus. The more it replicates, the more it mutates, and the more variabilities we have with it. So the data that we used to hang our hat on is not necessarily going to be solid as new variants emerge. So I didn't really answer your question. I guess it would depend on how important it is for you to go to dinner.
Okay. This next one, and then I'm getting to the live questions.
I should say this.
Oh,
As my data showed, right now our data is indicating that we still have low to moderate transmission. So right now in St. Clair County, we're in pretty good shape. Things are starting to heat up very quickly in other counties, so I don't know what I would tell you if you were going to go eat in a different location in Michigan. But as long as we're kind of in this low range, doing things like that also have a little lower risk, right? The higher the transmission rate in the community, the greater the risk. So might want to do it now and not maybe in a month or two, right? However we go.
Okay, this next person said that their friend's doctor said they don't need the vaccine since they had COVID. Is this accurate?
I don't know how he can say that. There's no data to support that. It may be true, but it may not be true. We just don't have the data, so I wouldn't hang my head on it. I would assume that a previous infection confers some immunity. Whether it's enough for you to not be worried about getting infected or getting infected and spreading to someone else, I really don't think they could say that. I don't know how they could say that because we really just don't know the answer to that yet.
All right, now I'm moving to the live questions, and for people who had asked questions earlier, Doctor has already answered some of them. You can watch back the show after we're done, and we also have it on our we will have it on our Health Department YouTube channel. So some of these I'm going to skip through because you've already covered them. Do you know at this point are schools going back full face-to-face?
Yes, that is the plan.
Okay. Does the Delta variant affect younger children differently?
Not that we know of.
Okay. What is the likelihood that a vaccinated person will contract a Delta variant?
Less than an unmasked vaccinated person, which is less than an unvaccinated person. So your best defense is the vaccine. Your second best defense is your mask. And then your third layer, if you will, is air circulation and distance from other people. And probably the least important, not that it's not important, but surfaces and contaminated surfaces. This really does seem to be a person-to-person respiratory virus spread. So, you can washing your hands is always important. I'm not saying it's not, but probably vaccine is first, masks are second, and distancing and air circulation would be the third most important. So we put those all together and you have pretty good protection, right? You take them apart and you lose a little piece each time you take that apart.
Okay, next question is, are we able to choose what COVID shot we want to get or find a place that has one you prefer?
Probably. When we were doing our mass vaccination clinics, we would take what we had and you could get what we had or you couldn't get it. Nowadays, I think you could call around and find any number of vaccines in many locations. So all you got to do is ask and you could probably find it. We have all three vaccines. I think most pharmacies are carrying the vaccines. So I do believe you could seek out the vaccine of your preference.
Would you say more people are getting vaccinated in our county?
Doesn't seem like it. There's been a slight uptick. Where's Brandon when we need him? I don't know how many vaccines we added to our roster last week, but we're really just 100 at a time per week, I think, is the kind of the number that we're getting. It's not a lot.
We had about 300 first doses last week.
Thank
and
you.
About 600 first doses this week. So
it has doubled. Sorry about that. All right. You did tell me that and I didn't save it. Sorry.
Thanks, Brandon. Mm-hmm. Is the Delta variant still deadlier for older people and those with underlying conditions?
Yes.
Would you personally mask your child to send them back to school?
Yes, I would.
Do you suggest that a vaccinated person with an underlying health condition that does wear a mask stay out of the public as before?
I think if I were vaccinated, if I were a vulnerable individual, which I kind of am, right? I'm overweight and I'm over 60, so yeah, I guess I'm there. Sorry, obesity is a risk factor, okay? It is. Hypertension, diabetes, age, okay? So I would probably still go outdoors in an outdoor event. I would be comfortable with that with a mask on, even maybe without a mask on right now with their transmission being low. But indoors, I would definitely mask. And if it was a very packed venue with a lot of people I didn't know, I probably would pass at this point as far as going. So that's kind of my assessment for my risk. Everybody's got to make an assessment for their own risk. But and I perfectly support everybody making that decision. I would just ask that people acknowledge the risk for what it is. People are doing a terrible job, in my opinion, doing that risk assessment for themselves. They're filled with all of these kind of conspiracy, nefarious things that could go wrong, when the reality, the virus is really our chief contender here. It's our chief thing to be afraid of, and you need to be aware of what your risk is against that virus, whether you're vaccinated or unvaccinated, your state of health, the situations you're in, and that's where you should be making those calls, and the importance of the situation you need to be in. Sometimes it might be worth it for you to take that risk, and that is your choice, and you're allowed to have that. But know that you're making a choice to be in a greater situation of risk. I think that's the important part I want to get across to people. So if you're not vaccinated and you're choosing not to get vaccinated, you will in fact be at greater risk for all of this, regardless of what you do.
Okay. Is it possible that COVID-19 could mutate itself out within a year?
Oh, what a great question. I don't think it's going to mutate itself out because, viruses are biological organisms that exist to survive, right? So whatever it does, it's going to be, the biological pressure here is going to be for it to survive better, okay? Which, by the way, often prevents it from becoming deadlier because it doesn't want to kill off all of its hosts. It's kind of a contrary thing biologically as well. But within a year, I don't think epidemiologically that makes a lot of sense when you have a worldwide kind of pandemic. Just think about the millions and millions of people who are infected right now, what it would take for that whole thing to shift. I do expect it to mutate, though. There's no question when you have this much transmission, we will see more variants. And what those variants are and what they do, I think remains to be seen. It's going to be an interesting year for sure.
I'm not sure what Michelle's question is, but she says, and dying from the vaccine. Is this true?
So far, the vaccine appears to be very, very safe. Very few deaths have been attributed directly to the vaccine. Now, just because in VAERS, the Vaccine Adverse Events Reporting System, has deaths reported in it, does not mean the deaths are related to the vaccine. It just means somebody got a vaccine and within 30 days died. They put that in there. When you go back into the records, they may have died from cardiovascular disease or car accident. So deaths in VAERS does not equate deaths from the vaccine. And from my understanding of those reviews, because I just listened to this on the ACIP meeting, there is literally 0 confirmed deaths directly related to the COVID vaccine. So this whole idea of the vaccines killing people and stuff, I'm sorry, you must have access to some data that the rest of us do not have, because that is certainly not the impression that we're getting from reviewing that data, and more importantly, from going back and reviewing the medical records of those people who died to really kind of understand the circumstances. So the vaccine is safe, and no, it's not causing thousands and thousands of deaths at all. No, not at all.
Okay. We have a lot more questions, Doc, and we need to end by 4:30. So I'm just going to try to read these and get through them. If we don't catch you by 4:30, please email us these questions. Next question. Are you testing and reporting vaccinated COVID positive cases?
Yeah. If we get to them. I just want to say, over 50% of the cases that we get don't even answer the phones. They don't even respond to us. So when we can do a case investigation, we are absolutely reporting whether or not they're vaccinated or not. Yes.
Is the thought that you can't get COVID a second time still valid? I was fully vaccinated 8 months ago, confirmed positive for the Delta a few weeks ago. Is there still risk for reinfection that we should consider the booster if and when it becomes available?
So the first question, yeah, absolutely you can get reinfected. We know that. It's a given. You can get reinfected if you have a natural infection, and you can get reinfected, or you can get infected even though you've been fully vaccinated. The rate of which is still unclear, probably a lot less than the naive individual, the individual who has no immunity whatsoever from either cause. The other boosters are not available and not currently being recommended. Stay tuned. That may be a solution or maybe not.
Next question. Do you have long-term studies of safety of spike protein?
Oh, goes back to the question of long-term side effects from the vaccine. There is not a vaccine in history that has caused long-term problems. Virtually all side effects and adverse events from vaccines occur in the first 30 days, and certainly within the 30 to 60 days that we collect data from. So the answer is probably not, but why would you need it? It's a single protein that is on the virus, and we chose that because it's critical for the virus to enter our cells and infect us, and so therefore it is a logical and apparently I would say a very effective protein to use as the target for our immune systems to develop antibodies in response to. Vaccines historically, theoretically, biologically, generally don't cause any long-term problems because once they cause our immune system to respond, they're eliminated from our body. So the mRNA vaccine is gone from our body within a very short period of time, days, and that is the case for the J&J as well. So what's left behind after a vaccine is our own innate immune system and our immune system's response to whatever it was trained to respond to, in this case, the spike protein, which it would do, by the way, whether you had that or a real infection.
Okay. Do new PCR tests used in schools also test for flu or other viruses?
So first of all, I don't believe the schools use PCR tests. If they do, they're contracting. Virtually all the tests that were done last year in schools were the antigen tests because they were the ones that are rapid and available very inexpensively. We do have rapid PCRs. It's quite about difference in price. There are tests available that will now test for multiple respiratory viruses at the same time. I'm not aware of any schools that used those last year. Those obviously add a considerable amount of cost to the picture, but they will be available to differentiate between influenza, RSV, and COVID. Your doctors more likely will have those, more likely than a screening program in a congregate setting. I don't think that would be really likely, but maybe in a nursing home they might use them.
Have the rules for quarantining after exposure been changed for vaccinated people, or do we still not need to unless we show symptoms?
Yeah, so no, if you're fully vaccinated or if you've had a confirmed infection in the last 90 days, you do not need to quarantine if you have been identified as a high-risk exposure, direct exposure. However, the CDC has recently released that if you have been fully vaccinated and you are identified as an exposure, they would like you to test. You can go about your business, they'd like you to test, and they'd like you to mask. Okay, again, because of this knowledge now that the Delta can infect and replicate at pretty high viral loads, even in vaccinated people, even though they're not necessarily perhaps getting ill enough to kind of be aware. So you don't need to quarantine, but there is an extra level of precaution that we want people to take if they've been told that they're a contact. So testing, I think it stays. Jen, I apologize. I think I just sent this to you. We got to add this to our website. I think it's they want you to test on days 3 and 5 or 3 and 7 and wear masks for the full 14 days that you would be asked to otherwise quarantine. But you can go about your business unless you get sick, and then we definitely want you to isolate and get tested then.
This person asks, why is the health department only recommending and not requiring schools to social distance and wear masks? Why is this left up to the decision of a school board who is not educated on community health?
Ask your legislators. Ask your politicians. Ask your parents that are organizing to disrupt the public health code. There's a lot of pushback. And legally, it is the school's responsibility. It is their primary responsibility to set rules and regulations that protect the health and welfare of their students. So we're just kind of staying in our lane, if you will. And we're all trying to do what will work best for the majority of people. It's a good question, and I don't know that I actually have the best answer other than this has been one heck of a complicated, convoluted 2 years, and there's just a lot of pushing back and forth with this. So we'll watch closely, and we will work closely with your schools and do our best to give them what they need. They've been very clear that they would need something like an order to require masking in the schools, and it's not going to be coming from us at this time.
Okay, next question. Do you test for and recognize antibodies and T cells in millions of recovered COVID patients? Have you studied and compared
you can't
the
trust
vaccine
T cells really easily. T cells, that cellular immunity, is really difficult to study. You have to kind of do bone marrow aspirations, and so that's a very academic reality. I mean, we know that cellular immunity exists, and it probably is playing a really important role in our immunity, but it's not like you can have a blood test to do it. So T cell cellular immunity is not something your doctor can test you for. It's something we learn in the field over time. We will eventually understand that better, but over time. Antibodies, okay, serology, that can be tested in the bloodstream, but that has a lot of variability as well. And we are not accepting antibody testing as proof of immunity because there is a tremendous amount of variability with the tests, with what our body does. It is not understood. The science is not there yet to be able to take a piece of paper, a test that you had at laboratory alpha, and be able to tell you, yes, you now have immunity against COVID. It's not that simple, and don't fall for it. Do not waste your money. If your doctor orders it, that's great, but really have a good long talk with them about what that really means, because it does not mean you're immune to COVID. Okay, we cannot use that, and we are not using that as proof of immunity at this point in time. We might get there, but we're not there. Okay.
The second part of her question was, have you studied and compared length of vaccine immunity compared to length of natural immunity?
That I'm sure they're doing that. Have I? No, not me. We are certainly following that science. It's complex because we're getting waves and waves of natural infection, as you have heard, and we have a lot of variability in vaccine access. Some countries are just now starting to vaccinate. So it's a very complex topic, and I don't think it's going to be answered, quite honestly, for quite a while yet.
What qualifies as a quarantine close contact in schools?
It will be 6 feet if you're unmasked, and 15 minutes cumulative.
If I get the vaccine and have a bad side effect, how am I covered?
Covered. Like,
yeah, I'm not sure if she means through like VAERS, report it through VAERS, or?
Well, you'd report it through VAERS. She probably means liability coverage. So there's a Vaccine Injury Compensation Act of the federal government that still stands good for this vaccine as well. Again, those situations are rare. Your health insurance would obviously cover any illness that you would accrue through any cause. I'm assuming she means the vaccine compensation injury thing, and I might be saying that wrong, but yeah, it is still in effect.
Okay. The next one is, are you going to do the live videos weekly or still monthly? We covered that
Yeah,
earlier.
Jen brought that up, and I think it's time we went back weekly, don't you? There's lots of questions and a lot of things changing. So yeah, we'll be back here every week on Thursdays at 3:30.
Yep. Okay. How long do you feel we are going to be done with all of this?
I always get that question. Are you sick of it yet? Yeah, me too. I think this is our new reality, to be honest with you. Just like we used to go through waves of influenza and it kind of only impacted maybe 10% of us. This is just kind of like that on steroids. I'm not saying this is influenza, okay? COVID is not influenza. I just read that on some blog site. It's like, no, it's a different virus, guys. So we're still possibly going to get some influenza this fall when we normally get it. I think we're going to just have to learn as a society how to handle this. Quite honestly, it's a virus. It's a nasty virus. It's a scary virus, but it's a virus. We have a lot. We're going to get better at tools. We're going to get better at treatments. The vaccine is here. It's available. It works great. I think we're just going to have to get smarter and kind of figure this out.
Okay. Just a comment that Janet said, maybe we need a limit on how many questions and comments allowed per person here. And I'm trying to do that. So if you are getting in a debate with somebody on this feed, I'm not going to respond to your questions. I'll answer the valid questions. Okay. This person said, I had my second Pfizer vaccine on April 8th. My pulmonary doctor had me tested for the antigen, which came back negative. Does that mean my vaccines are no longer protecting me?
No. So she meant that her doctors ordered a serology test, an antibody test, the antibodies. And I just kind of mentioned that. The problem with antibody tests is the tests are like across the board, hard to to know which tests are good and which ones aren't good. It's hard to know if a negative antibody test means that your body just kind of rapidly converted to strong cellular immunity. We do have some vaccines that work very well that we don't advise getting antibodies for because we know they're not going to necessarily be there. And we also know that doesn't mean you have good immunity. You know what? The bottom line is I don't know. We don't know what that means. Right now, we are not advising people who have a negative serology test after vaccine to get revaccinated or to get a booster that may be coming in the future. We just don't know yet. So maybe just be a little extra careful. Thank you for getting vaccinated. I'm going to assume that it worked to some degree for you, but we do know that some people don't respond to the vaccine as well. We do know that. Okay, so I would just be a little extra careful maybe if I were you. Mask, sorry.
The next person asks, when will a vaccine be available to younger children?
Under 12? Yeah, somebody asked me that too and said maybe October. You know what? That's up to the FDA and the people that are reviewing all this data. I did hear that Pfizer had a good amount of pediatric data that it's ready to review and release. So it could mean by the end of the year. I've been hearing that a little bit earlier, but honestly, I don't know.
Okay. And the last question is, how is the J&J vaccine?
How is it?
That's what.
How is it against the Delta? Probably. And
Maybe
that's another great question. I have not seen any side-by-side. There is no side-by-side comparison studies on these vaccines against the current strain. And most of the data we have on these vaccines is against the old variants, not against the Delta variant. So it's a really muddled picture. We do know that the J&J seems to be very effective in preventing hospitalizations and deaths, just like the mRNA vaccines do. But I'm not prepared. I'm not sure I can tell you any numbers at this point in time. I actually asked that question not too long ago to our state consultants, and they're still looking into it. So it's a good question. I don't think we have a really good answer yet.
Okay, so it's 4:30 and we need to end the show. So just remember,
And we
everybody,
started
for
late
now,
too. I'm sorry, everybody,
yeah,
about that glitch. Yeah.
we'll be
Send your
back.
questions in, and we will try and I'll try and answer your questions. Jen will forward them to me, and I'll do my best to answer them if you send them to our email. Jen, what's the email address again so people know?
So people can send their questions to COVID-19 at stclaircounty.org, or they can call us at the COVID informational hotline, 810-966-4163, or you can send a message through our Facebook Messenger as well. But we'll be back on Thursdays at 3:30, and normally we run 3:30 to 4, but we'll stay till 4:30 like we did today if necessary, and we'll run weekly until we need to go back or can go back to a monthly. So Doc, any closing comments?
Deep breath. Deep breath. This is going to be okay. We got this. You guys all know how to do this, right? Assess your risk. Remember that your choices of what you do impact not only you and your family, but everybody around you as well. So if you get mad at somebody else for doing something, remember they're just trying to protect themselves too. Please consider getting vaccinated. It's a great vaccine. It is our key. It is our key to controlling this and not going back and forth into these terrible events where we're surging. So please do, please try not to swallow all the misinformation out there. It is so numerous and crazy. And I know if you hear it 100 times, you start thinking it must be true. A lot of it's not true. So go to a valid, reliable site. Listen to people who understand immunology and who understand vaccines and understand virology. And listen to them, okay? Because it's complicated and it's really hard to kind of, do your own research when it's coming out of places that want you to believe the vaccine is bad. They want you to not to get it. I don't understand why people would knowingly want to discourage people from taking something that can save their lives and save somebody else's life. To me, it doesn't make any sense, but we live in a crazy world. So please reconsider. If you're on that fence, talk to people who understand it, and we'll be out there trying to make sure that people understand as much as we know, right? And as we know more, we'll try and explain that too. So thanks everyone for joining us tonight.
See you next week. Thank you.